Hey guys, welcome back to my YouTube channel Dr. R.kmedicos. In this video, we are going to discussing about pharmacokinetics. In this section, we will discuss about the membrane transport of drugs, absorption of drugs and distribution of drugs. So continue to watch my video at last and never skip this video. And if you are new at my YouTube channel, then please subscribe, like and share my YouTube channel and never forget to press the bell icon so that you will get notification of all video uploaded by me on my YouTube channel. Let's start this video without escaping the time. Firstly, we'll see what is pharmacokinetics. So guys, it is nothing, it is the quantitative study of drugs movement in or throughout the body, and all the pharmacokinetics process involve the transport of drugs across the biological membrane, as you already know. Now we will discuss about the drug transport across the biological membrane. As you know that the drugs are transported across the membrane by two mainly mechanism, and first is passive diffusion and filtration, and the second is a specialized transport. Now the passive diffusion. The drug diffuses across the membrane in the direction of a higher concentration to lower concentration, that is across the concentration gradient, as you already know, and the membrane playing no active role in this process because this process does not require any type of energy, and a lipid soluble drugs diffuse by dissolving in the lipoidal matrix of the membrane. Now we will focus on the factors affecting the rate of diffusion across the biological membrane. Firstly, we will see about the solubility of drugs in lipid. As you already know that the rate of diffusion of drugs across the biological membrane is directly proportional to solubility of lipid. That is, the drugs which are more soluble in lipid will be diffused more rapidly across the biological membrane. And the second factor is the concentration gradient, and the rate of diffusion of drugs across the biological membrane is directly proportional to concentration gradient. That is, drugs will be diffuse more if the concentration of drug is higher, and that is it diffuse from a higher concentration to lower concentration. Now we will see the influence of pH. Most of drug are weakly electrolytes, that is their ionization is pH dependent, and the ionization of weak acid is given by the equation, and that is as you can see on your screen, that the pH equal to pK plus log and ionized part of drug by non-ionized part of drug, where the pK is the negative logarithm of acidic dissociation constant of weak electrolyte, as you already know. If the concentration of ionized drug is equal to the concentration of unionized drug, then ionized equal to non-ionized part, and since the log 1 is 0 under the condition, thus the pH equal to pK, right? And thus we can say that the pK is numerically equal to pH at which the drug is 50% ionized, that is the ionized part equal to non-ionized part. If the pH is increased by 1 scale, then the log ionized part by non-ionized part equal to 1, or ionized part by non-ionized part equal to 10, right? And similarly, if the pH is reduced by 1 scale, then the ratio of ionized part by non-ionized part become 1 by 10. Now we will see the behavior of drug at the different pH. And firstly is that the weakly acidic drug and which form the salt with cation, example the sodium phenobarbitone, sodium sulfadiazine, and potassium penicillin-V etc., and ionize, and this weakly acidic drug ionize more at alkaline pH, that is when one scale changes in pH causes the tenfold changes in ionization, right? And the weakly basic drug and which forms the salt with anion, example the atropine sulfate, ephedrin HCl, and chloroquine phosphate etc. Unlike weakly acidic drugs, the weakly basic drug ionize more at acidic pH. Well, you know that the weakly acidic drugs ionize more at alkaline pH. Now we will see the some important point associated with drug, and first is the acidic drug, that is aspirin, and having pK value 3.5 are largely unionized at acidic gastric pH and are absorbed from stomach. Well, the bases like atropine, which having pK value 10, are largely ionized at gastric acidic pH, but are absorbed only when they are reached to the intestine, right? And the lipid soluble non-electrolytes Example, ethanol, diethyl ether, readily cross biological membrane, and their transport is pH independent, right? And this is very important point which should be remembered in your mind. Now we will discuss about the ion trapping. What do you understand by the ion trapping? The unionized form of acidic drugs which cross the surface membrane of gastric mucosal cell revert to ionized form within the cell at pH 7, and then only slowly pass to extracellular fluid, and this process is called the ion trapping. And now we will see the filtration. And what do you understand by filtration? Filtration is a passage of drug through the aquospore in the membrane or through the paracellular space which are present within the membrane. Now we will discuss about the factor affecting the filtration of drug. And first is filtration of drug is directly proportional to hydrodynamic flow of solvent, and which is occurring under the hydrostatic or osmotic pressure gradient. And the second factor which affecting the filtration of drug is the diameter of pore. As you already know that the lipid insoluble drug cross the biological membrane if their molecular size is smaller than the diameter of the pore, right? And the diffusion of drugs across the capillary is dependent on the rate of blood flow through the membrane, and rather than on the lipid solubility of drug or the pH of the medium. In this way we can say that the diffusion of drugs across the capillary is only depends or mostly depends upon the rate of blood flow through the membrane, right? And it partially depends upon the lipid solubility of drugs or the pH of the medium. Thank you for watching my video at last, and I hope that this video will be knowledgeable and informative for you.